Good evening, sir. Come in and take a seat.
Oh, thank you.
Okay. Mr. Purinat, isn't it? Am I pronouncing it correctly?
Yes, that's right.
My name is Mr. Vipat. I am a nurse. You can call me Inter.
Okay.
What would you prefer me to call you?
PM is fine.
Okay, PM. Sorry to have kept you waiting.
Mm-hmm.
I do apologize. Today we have a lot of patients.
Okay. Thank you.
I'm going to ask you for a few questions before you see the doctor.
Mm-hmm.
First of all, do you have any relatives to come with you? During COVID-19 situation, we allow only one relative to come with the patient.
Okay, I come with my mother. Can I call her?
Okay, you can call your mother.
Hello, mother. Please come in. Mm-hmm.
Okay, sure. While waiting for your mother, how do you feel today?
I don't feel so good. I have a stomachache. Very
Stomach
painful.
ache. Okay. How long have you had that?
About yesterday.
Yesterday. Okay.
Sorry, and his mother.
Okay. PM,
Mm-hmm.
have you ever suffered from allergies?
I don't think so.
No?
Oh, so sorry. He is allergic to penicillin.
Oh.
He can remember that because it happened when he was just 5 years old.
Okay.
Oh.
He is allergic to penicillin.
Yes.
Can you remember what is his symptom when he took penicillin?
I remember that he had face swelling, noisy bleeding, and red and white skin rash on his body and leg.
Okay, that sounds terrible. Do you have a drug allergy card?
Oh, we forgot it at home.
Okay, that's fine, no matter. Don't worry. Okay. Take this and wait for we call your number. If we call your number, please come to the doctor room 4.
Mm-hmm.
Okay.
Okay.
Okay, thank you, doctor.
Good evening, sir. Mr. Kim, right?
Yes, that's right.
And you are his mother, aren't you?
Yes.
Okay. My name is Vidya. I am an internist doctor. What bring you here today?
I have a stomachache.
Okay. I see from the nurse note you have abdominal pain for 1 day, right?
Yes, that's right.
Could you tell me a bit more about it?
It's very bad. It's white.
Okay. Can you describe the characteristic of the pain?
Yesterday I got a dull aching pain around my navel, and now it's moving to here. It's white. I don't know how to call it.
Where your abdominal pain go to?
Now it's only here.
Okay. Are you have any other symptoms such as vomiting, diarrhea?
Yes. This morning he says he felt upset on his stomach and he ate breakfast and lunch less than half of usual, and he vomited 1 time while coming to the hospital.
Okay, Mr. Kim, I have a lot of information about your present symptoms. Then I would like to have a more detailed picture of things. Could you tell me about any illness you might have had in the past?
Since I was 7 years old, I think I have a lung disease. Something I have to use the device. I don't know how to call every day to relieve my chest symptoms. I don't know.
I think he can remember what is it. He has asthma and he uses the medication for control his symptoms.
Okay. Does he still use his bronchodilator? I mean the device that help him when he has chest tightness.
Yeah. He used the bronchodilator about twice a day in this morning and this evening, and his asthma is well controlled.
Okay. Any other Chinese illness?
The only common cold, fever, something.
Okay. Are you fully immunized?
Oh, I can't remember.
I can answer this part for him. She's fully childhood vaccination, include COVID-19 vaccination, about Pfizer 2 doses.
Mhm. Have you ever suffered from allergies? Oh, I see from nurse notes you have allergic to penicillin, right?
Yes, that's right.
Okay, from the symptom you told, I think it was a serious reaction we call anaphylaxis. Have you had any operation?
No.
Have you had any injury?
Injury? No.
Okay, then I'd like to have more information about social history. Do you drink alcohol or smoke?
No, not at all.
Okay. Can I ask you about any medication you might be taking at this moment?
Only acetaminophen for my fever or headache.
Okay. How about the medication you buy over the counter?
Oh, only that things.
Okay. Now I'd like to ask about your family health. Does your family have any health issue?
Yes, it's me. I have diabetes.
Okay. How old were you when you were diagnosed?
I'm not sure. I think about 35 years old, and it's well controlled.
Okay. Now I like to sum up your history briefly to make sure that you have had abdominal pain for 1 day. Other symptoms were upset in your stomach and vomiting for 1 time. You have asthma and now it is well controlled. You have got full vaccination including COVID-19 vaccine. You have allergic to penicillin causing anaphylaxis. Your mother has well controlled diabetes. Okay, is that an accurate summary? So have I missed anything out?
I think it's okay.
That's right.
Okay, alright. I have more information about your symptom. Next, I'm going to examine your abdomen for health diagnosis. The nurse is going to explain to you and help you prepare yourself.
Okay, thank you, doctor.
Okay.
Okay, Mr. Prim. Okay, the doctor tell me that he want to examine your abdomen and he sent me to help you. Okay, first of all, you might want to go to the toilet. The doctor need to examine your abdomen with your empty bladder.
Oh, it's okay. I just went before I came in.
Okay, that's right. So let's get started. First of all, if you could take off your shirt and lie on the bed and just lie on the bed behind me. Don't worry about your private part. I will cover it with the blanket.
Okay.
Okay. Do you have any question or any concern about the examine of your abdomen?
No, that's fine.
Okay. So let's go.
Okay, Mr. Pim, if you feel comfortable, could you please bring your knee up and put your feet on the bed?
Okay.
Okay. I will put the pillow behind your knee to relax your abdomen.
Okay.
Okay, I'm washing my hand and warming my hand before examining your abdomen. Next, can you point to the area of the most painful?
Oh, it's right here.
Okay, I see. Now I'm going to examine your abdomen by following the step. and I want you to tell me if you feel uncomfortable
Okay.
or are in pain. Okay, first I'm inspecting your abdomen. There is no abdominal distension or surgical scar. Next, I'm going to auscultate your abdominal sound with stethoscope. Okay. No abnormal sound. And then I'm going to palpate for quadrant, starting at areas that are not painful. How do you feel? Pain or not? It's fine. Okay.
Okay, fine.
Okay.
Fine. Oh, shit.
Oh. I see it seems to be some degree of inflammation in the organ around here, such as muscle, small or large bowel, and appendix. Then I'm going to check the degree of inflammation by deep pressuring on this area and then releasing the pressure. Would you mind if I deep palpate on this area? If you are in pain when releasing pressure, please tell me.
Okay.
How do you feel?
Oh, shit.
I see. Alright. Just one more examination left. I'm going to percussion on your abdomen to evaluate fluid collection in your abdominal space. If you're uncomfortable, please tell me. Okay, and just lie on your left side. Okay, Mr. Pin, just lie on the bed. Okay, finish the examination.
Does his abdominal pain seem like a serious problem, doctor?
Okay, from the history and examination, I think the cause of abdominal pain might be appendicitis. But we need to confirm this diagnosis by ultrasound. I'm going to consult the radiologist to examine his abdomen with an ultrasound scan. But don't worry, during this, the nurse is staying with you.
Okay.
Okay, Nathan, don't worry, your child will be okay. After the radiologist examine him with ultrasound scan, the doctor will know the diagnosis.
Okay, I hope that. I think he just have a food poisoning or something like that.
Okay, I understand. The first symptom of appendicitis is as same as food poisoning. It is difficult to know.
We heard something ultrasound or the doctor say.
Oh, ultrasound scan? It is not hurt. Just right, the doctor examine your abdomen, but the radiologist will use the device that can make the image of your organ, so we can see where is the problem.
Okay.
Sorry to keep you waiting for a long time. I'm going to give you your result, and then we will discuss where to go from there. Okay, first of all, your ultrasound result show that you have appendicitis.
Oh.
Can I just check what you understand about the appendicitis?
Oh, I don't know.
I think it means the appendix is swelling.
Yes. Let me explain appendix is an organ in the lower abdomen below your intestine. Now it is inflamed. This is a serious problem. If it left untreated, it's called high temperature infection in your abdomen.
Are you sure, doctor? Does he need another test to confirm the diagnosis?
I check very carefully. The ultrasound scan is enough to make the diagnosis and plan for treatment. In this case, we have 3 choices for treatment. First of all, to open surgery, making an incision and removing appendix directly. You will have a small incision about 3 or 4 centimeters. And secondly, laparoscopic surgery. Instead of making a large incision, we just make small incision and insert the tool, including a tiny video camera. The surgical instrument, the advantage is smaller scars, and you can get out of hospital quickly. And the disadvantage is you need to pay extra for the extra instrument. And finally, the antibiotic. If you don't want to surgery or any operation, I will prescribe you an intravenous antibiotic, but it has higher rate of failure and the symptom will be worse.
Oh.
I know this is a lot of information. Is
Yes.
there anything you would like to ask me?
So I have to surgery, and does the asthma, my underlying, affect the operation or something?
Oh, of course. The induction of sedative that may make your asthma attack or make you have difficult breathing. But we can manage this, don't worry.
Oh.
I think laparoscopic surgery is the best choice for him.
Okay. Just to recap on what we have discussed. You have appendicitis. You are going to surgery to cut your appendix out.
Okay.
We decide to do laparoscopic surgery, which can help you to have a smaller incision and can get out of hospital quickly.
Okay.
Okay, thank you.
Okay, the nurse will tell you about admission to hospital.
Thank you, doctor.
Okay.
Okay, today you need to admit in the hospital and prepare yourself for the surgery. Okay, please fill this. Please read this and fill the information about admit in this hospital. Okay, if you have any question or if you need some support, you can tell me. Okay,
Thank you.
I'll come back.